Hi, I'm Susan Hogeland. I'm Executive Vice President of the California Academy of Family Physicians, and we're continuing our experiment with a weekly video blog to tell you about activities at the Academy. But this week, because of the public health emergency that's been declared around swine flu, and because of the fact that I happen to be in Mexico right now, we thought it might be helpful if we brought you some information that could be of use to you in your practices. We have with us Dr. Amy Kindrick, an infectious disease specialist from San Francisco General Hospital, and Dr. Kindrick will give you some information about the situation that we're experiencing and some information about how you can respond in your own practice should you have a patient who comes to you with symptoms that resemble swine flu. So without further ado, let me introduce to you Dr. Amy Kindrick. Thank you. Dr. Kindrick, what should a family doc know about treating patients in his or her office?
Well, the first thing to think about is, if possible, to ask patients who might have influenza not to come to your office. Obviously, if they need to be evaluated, they need to be evaluated. But it's best really at this point to try to support people to stay home, stay out of public spaces, stay away from any place where close contact with others might potentially result in a transmission. If an individual, though, does need to go out of the house, and there's a high index of suspicion for this swine flu strain, then the recommendation from the CDC is that they use a face mask.
Just a regular surgical type of face mask?
Something is better than nothing. What's even better is one of those respirators that's approved for use for TB protection. But any covering should be best. What we really want is to avoid respiratory droplets from an infected person landing on someone within about 6 feet or so. So we want to interrupt the path of those droplets that are produced by coughing or sneezing or hand-to-hand contact as well.
And how might these patients be treated if indeed they're identified?
Most of the cases outside of Mexico have not required treatment. The symptoms have been relatively mild and have resolved pretty much with symptomatic management. There are 2 antiviral agents that are active against H1N1 influenza virus. This is an influenza A virus, and Tamiflu and Relenza are both thought to be active against this swine flu strain. Now, just an aside, Tamiflu is not actually effective for human H1N1 influenza A that's been around this season. So fortunately, we do have the 2 drugs in the armamentarium. The CDC is recommending that only individuals who are at substantially increased risk for influenza complications, such as immunocompromised patients or patients with chronic illness, be considered for prophylaxis if there has been an exposure to a highly suspicious case.
And so if patients are calling their doctors and demanding prescriptions for these drugs, what do they say?
Well, first of all, I think it's important just to reassure these patients. I know it's difficult when something comes up in the news like this, and people do feel very concerned, and certainly for influenza you want to take note, but we are not in a position right now to expect that people will become severely ill or start having to be hospitalized or cared for in intensive care units, at least not in the U.S. and apparently not in Europe or South America.
So the bad news is we may have an epidemic, and the good news is it's fairly mild.
So far, so good, although the WHO and the CDC are keeping very close watch on this. In fact, earlier this afternoon, the WHO raised the alert level. There are 6 levels of alert regarding influenza outbreaks, and we're now, as of this afternoon, at level 4 of 6, which means that human-to-human cases transmissions have been documented, and that they have occurred regionally, and that they have occurred in more than one country. And the interpretation is that there is a substantial risk for a pandemic to emerge.
Dr. Kindrick, thank you very much. We may call upon you again as the situation develops over the rest of the week, and get your opinion then. Thank you.
Thank you so much, and I hope you won't see me with a mask on next time.
So to wrap up this webcast, we want to advise you that you can get more information about the swine flu situation from the CDC website, which is cdc.gov/swineflu. And we also have a link on our Academy of Family Physicians website, where you are now, so just take a look there. And apparently CDC is also twittering about swine flu. So we'll be back to you. Thank you.